Hello, I'm Dr. Acebedo. Today we're going to talk about heart cancer. So it's been mentioned in the literatures that it's really rare to have primary tumor of your heart. And the reason for that is, I think, based on my opinion, is because heart has a lot. It's pretty active. It's beating every minute. It has a lot of mitochondria. So I'm a big believer that the cause of the cancer is damage to the mitochondria, right? So once there's damage to the mitochondria, then this sends signal to the DNA and causes a lot of cascading events, eventually leading to DNA mutations. Anyway, what are the types of heart cancer? So majority of them are benign tumors, and there are three categories in benign tumors of cancer. So one is myxoma, next is fibroma, and number three is rhabdomyoma. These are all benign tumors, and then the malignant ones are usually, one is sarcoma, number two is rhabdomyosarcoma, number three is primary mesothelioma, and number four will be fibrosarcoma. So I'll talk briefly about the benign tumors, which is myxoma, because this is a pretty common benign tumors that we see in heart tumors. It's believed that heart tumors is really rare. It's 1 to 100,000 of people, or 1 is to 2,000 of autopsied bodies. They'll have tumor. And in fact, it's so rare that even heart surgeons, they only see on average one case each year, if ever. In fact, in Mayo Clinic, they said they only see one heart tumor every year. So this is really rare. So if we talk about myxoma of the heart, usually it is pretty commonly located in the left upper part of your heart, which is the left atrium. And the most common symptoms is usually obstructive symptoms, especially if it is close to the mitral valve. So one of the common symptoms will be shortness of breath when you're lying down in bed, or shortness of breath when you're sleeping. Some will have like low-grade fever, night sweats, joint pains, and some obstructive symptoms like pulmonary edema, congestive heart failure-like symptoms, because as the tumor starts to grow and obstruct the flow of your blood, this will lead to backflow of your blood to the lungs. So, and then some people will have arrhythmias. Atrial fibrillation is common. So one of the workup that we do in atrial fibrillation patients, the first time they present, is to the echocardiogram, and which we're going to talk in a few minutes. So those are the most common symptoms of patients with myxoma. And even if you have fibroma, this is really rare. Again, you'll have obstructive symptoms, and usually shortness of breath and pulmonary edema. So now, how are we going to diagnose heart tumors? Usually it's really rare. You don't have symptoms at all, but once you have symptoms, one of the diagnostic modalities that we use is usually the echocardiogram, will give you a view of your valves and your atrium and your ventricles. And some will do CAT scan if they see something in the heart. And you do PET scan, MRIs, and PET scan, all of these modalities, but the basic one is echocardiogram, because you will see the structure within your heart, three-dimensional structure. How are we going to treat tumors? Usually it's surgical removal, because it causes obstruction symptoms. They can have robotic surgery to remove it. And then what are the most common causes? What drives heart cancers? Usually it's age and genetics. There are a bunch of people where they have, for example, for myxoma, it's 90% of it are sporadic, but 10% are usually inherited from their parents. They have what we call Carney syndrome, which includes myxoma of the heart, and that's usually genetic, so just 10% of it. And so how are we going to we talk about prevention. How are we going to prevent this? So again, in integrative medicine, we always employ, we always recommend, diet, lifestyle, nutrition, exercise. Now, as far as nutrition is concerned, we just not emphasize conventional medicine. We talk about, eating organic, plant-based, or some people would prefer to do ketogenic diet, but avoiding, chemicals in our body as much possible, and couple that with exercise. Exercise will increase energy and increases oxygen delivery to your tissues, and cancer cells don't like oxygen. So it is believed that if you do lifestyle change and avoid processed foods and avoid sugars, along with exercise, that decreases your risk of cancer by 60%. That's huge. So those are the things that we do, and of course some other stuff that we do in our clinic that includes detoxification, because we need to get rid of the toxins that we are exposed to every day. Even by just going outside, you get exposed to some particulate materials that are in the air. So as far as detoxification, you can refer to my podcast on that. It's a pretty detailed discussion on detoxification. And one of the things that we do here in our clinic is to find out, see if you have some problems with the immune system. And one of the things that I've seen is a lot of our cancer patients, they have viruses. One of the things that I do is check your viral panel, and Epstein-Barr virus always comes up. Pretty common reactivation of the Epstein-Barr virus. That's one thing we need to find out. Also, one of the tests that we do here is the RGCC, which is the Greek test. It will tell us if you have a circulating tumor cells. And we have patients coming here, just want to know if they have cancer or not. Aside from conventional cancer screening, we do the circulating tumor cells. And that's important to know if you have a circulating tumor cells. I have a few patients that come here, they don't have any symptoms, and they just want to know if they have cancer or not after going to different conventional doctors, and they measured their colonoscopy, for example, mammogram. Those are pretty common modalities for cancer screening. And then I do the Greek test, and they don't have a circulating tumor, so it came out 0. So that will be helpful to know. For secondary heart tumors, usually it's metastatic, and the most common ones are lung cancer, esophageal cancer, breast, and lymphoma, leukemia, kidney cancer. So basically, in this case, we have to treat the primary underlying cause with chemo, radiation, and radiation therapy, and of course the integrative therapies that we offer here. So thank you for listening. If you have any comments or questions, just leave it down below and we'll answer it accordingly. Thank you so much.